Hi, I'm Brittany Montez, and this is the Orlando Health News Review for July 15th. Modern Healthcare has named Orlando Health South Seminole Hospital and Orlando Health Dr. P. Phillips Hospital as best places to work in healthcare for 2020. Both hospitals were selected to receive this national distinction due to their success at creating an empowered, engaged, and satisfied workforce. And since March, Orlando Health has been sharing with you COVID-19 updates as part of the organization's commitment to ensure our team members and physicians have the information they need to respond to the pandemic and support our recovery. This Friday, we will mark the 100th email update. But do you know how each daily update is produced? It's certainly a team effort, actually several teams, investing a lot of time and many resources on each update. The finance department collects our system-wide data on COVID-19 positive patients and ICU and ventilator usage. It's also our finance department that calculates the daily snapshot data so that we can see how Orlando Health's current income and volumes compare to 1 month and 1 year ago. The supply chain team works to inventory the organization's PPE, which is shared in a stoplight graph based on having more than 45 days inventory. The strategic planning team analyzes our data along with our 4-county reporting to give us an overview of how our daily counts are moving and how we compare in our region. Human resources, infection prevention, and quality and safety experts keep you connected to important processes in response to COVID-19, and regular wellness and resilience messages help you find some calm during this busy time. All is packaged and narrated by internal communications and strategic communications before it's sent to senior leadership, with David Strong and Dr. Akeem reviewing every update. And once it's approved, internal communications and med staff services make sure it's sent to our team members and physicians. And recently, I was able to take part in a donation of wedding gowns with Chief Financial Officer Bernadette Spong and NICU Nursing Operations Manager Ann Diaz for much-needed formal wear for our tiny babies in the NICU to be made into baptismal and bereavement garments.
This was just really something that popped in my head. Rick and I celebrated our 38th wedding anniversary the end of May. The gown has been with us for probably 6 or 7 moves, so it was time to get it out of the closet, and I just thought what a great opportunity for someone to be able to use the gown for either a very special occasion or maybe a very somber but moving occasion.
It's really a beautiful thing to be able to take something from such a special time in our life and give it back to a special time in someone else's life. And it's very meaningful, I think, for us to work here in this place and to be able to do that. I feel bringing my own. My mom made it for me, and she's not here any longer. But I love this place, and I love what we do here, and I would like for the babies that I serve to have a little piece of my heart and about my mom's heart. So that's why I'm donating my dress.
And if you're looking for information on COVID-19, both clinical education resources and general information, visit the COVID-19 site on Swift. On the COVID-19 Education Resources page, you'll find valuable approved COVID-19 education materials like PPE tools and discharge instructions. The site also is available from your mobile device for just-in-time education and access. Well, that's it for today's edition of the Orlando Health News Review. See you next week.